This bridge, the Bloor Street Viaduct, used to be a suicide magnet. Only the Golden Gate Bridge in San Francisco saw more deaths in all of North America. Now, in 2003, this barrier was put up after years of very heated debate about whether or not it would save lives. And today, we have the answer.
When I stood on the edge of a bridge, that never even entered my mind. Nobody had even talked about the possibility that my suicide could be prevented, that my attempt could be prevented.
Mark's life was saved by a stranger, but the mental health advocate says a barrier would have also given him pause.
I was growing up in a small town where we never had, especially at that time, any discussion of suicide prevention barriers or fences or signs or phones or any of this stuff that we now know is best practice to have near bridges.
The construction of this suicide barrier back in 2003 followed years of outrage and derision over fears the $6 million cost was a waste of money, that desperate people would just find another bridge to end their lives. And a study done by this Sunnybrook researcher back in 2010, 7 years after the barrier was built, appeared to back up that fear.
There was clearly an uptick in suicide deaths at other bridges in the city in just the few years right after the barrier was put up.
Dr. Mark Senior has just now published a new study looking at 11 years of coroner's reports and has found a very different outcome, that over the long term, deaths by bridge suicides have decreased across the city since the barrier was put up. So why the initial increase at other bridges?
There was a media effect. In fact, there were many news articles that had happened just before the barrier was put up, many of them talking about negative things, that people will die in other ways, that the barrier is a waste of money. And in fact, the worry is that had a chilling effect on at least some vulnerable individuals and might have influenced their behavior.
A number of years ago, the Toronto Board of Health came out with a study that found 220 people die by suicide every year in the city, most of those from hanging, falling from heights, or overdoses. 7% involved collisions with subways, trains, and cars. The Board of Health specifically called on the TTC to bring in platform barriers. And Mark Hennick says this study of the Bloor Street Viaduct shows barriers save lives.
It's the same debate, it's the same argument that happened with the Bloor Street Viaduct at the time. Expense, TTC says that they don't have the money to do it, that they would have to automate the trains in order to make a system like that work. But in the long run, in terms of both saving of human life as well as saving of time and expense and the efficiency of the system, it's the right investment to make.
I was talking to the TTC about this idea of having barriers at platforms. They say there are suicide prevention techniques at subways and streetcars across the system, but that it's completely prohibitive and about $1 billion. Well, the way we talk about suicide, particularly in the media, can have a life and death consequence. I spoke to mental health advocate Mark Hennick today about this new study that blames in part media contagion for an increase in suicides across Toronto at bridges after this barrier was put up on the Bloor Street Viaduct in 2003.
What happened with the Bloor Street Viaduct, I think, as a result of 5 years of debating and arguing and intense media coverage on that project, the expense of the project, that seems to have actually created something of a spike in suicide, that much conversation about it. It's a good thing to talk about suicide, don't get me wrong, but it needs to be done in a productive way.
The theory is that there was an increase in suicides after all of the discussion about the suicide prevention barriers on the Bloor Street Viaduct. Do we raise concerns about contributing to that by talking about it right now?
I don't think so, because there's a right way and a wrong way to talk about suicide. For example, without sensationalizing, without glorifying or making it seem like a viable option. Suicide's not a viable option. More than 90% of suicides in Canada, there's a pre-existing mental health condition at the time of their death. So we need to be able to get people help. However, unproductive ways of talking about suicide, for example, we've had a lot of recent discussion about the Netflix series 13 Reasons Why. There does seem to be anecdotal evidence that 13 Reasons Why is contributing to suicidal thoughts among teenagers. So there is a right way and a wrong way to talk about these things. I think having productive conversations about how to prevent suicide, that's the right thing to do.
And the best thing, if someone's watching right now who's feeling as though they're relating a little bit too much to this conversation and needs help, what's the best thing for them to do?
Reach out to the Canadian Mental Health Association or call Distress Centres Toronto. Just speak to a friend or a loved one or your doctor. Talk to somebody, tell somebody. We know that almost 4,000 people every year die by suicide in Canada, and every single one of those is preventable.
And Mark Hennick is living proof of that. He found himself in a situation where he was saved by a stranger. If you've been watching this and you do feel like you are in distress, it's important to look at Mark and know that there is an answer. You can call the number on the screen below.